Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there is one new case of COVID-19 to report. The total number of cases is now 282. We are reporting an additional death today, a man in his 70s from the Southern Health Region, and we extend our condolences to their family and friends. This brings the total number of COVID-related deaths in Manitoba to 7. As of this morning, 4 individuals are hospitalized, and none of those are in intensive care. 238 individuals are listed as recovered. There are 37 active cases. Yesterday, an additional 339 lab tests were performed, and that brings our total lab tests at 27,775. Public health officials are aware of a small cluster of 5 cases in the Prairie Mountain Health region. It's in a workplace. The affected staff and their close contacts are self-isolating. Public health officials are working with these patients to undertake detailed contact tracing. Officials are working cooperatively with the company to test other workers who may have been exposed and to implement sanitation protocols at the workplace. If public health officials at some point believe there is an increased risk to the public, additional information will be provided. This is not a healthcare related workplace. I continue to encourage anyone who has symptoms of COVID-19 to get tested. We've increased our testing capacity. We've increased our testing eligibility. So any symptomatic Manitobans are now eligible for testing. Anyone with respiratory symptoms, fever, cough, runny nose, sore throat is eligible to be tested for COVID-19. As we move slowly to restore services in a cautious way, we need to do this very slowly, very carefully. We'll be monitoring many indicators to guide our future considerations. And so it's important to know that this is not a return to normal. This is a gradual reopening of some aspects of the economy. Some non-essential businesses are opening while others are remaining closed. We need to do this very cautiously. We cannot open everything at once. We're opening small number of essential services or non-essential services with significant restrictions. We need to do this very slowly and monitor our numbers very cautiously. There are no targeted therapies or vaccine yet available, so the critical public health measures are the new normal. We need to continue with our physical distancing strategies to limit the impact of this virus on Manitoba. These strategies include practicing good hand hygiene, washing your hands as frequently as you can. If soap and water are not available, then alcohol-based hand sanitizers will do. Avoid touching your face or eyes. Coughing into your sleeve. Continuing to stay home and spending time with members of your household as much as possible. Maintaining physical distancing when out in public. This includes keeping that 2 meters of separation between you and others. If meeting with friends and family, it's best to do so outside and to continue the physical distancing when you do so. What's vital as we move forward is that individuals stay home when ill, even with mild symptoms. So certainly call health links for advice, call healthcare practitioners for advice. It's safe to visit healthcare practitioners, but do not go to work, do not go out shopping, do not meet with friends if you're ill, even mildly ill. Workplaces need to be aware of this and have policies in place to limit the ability of workers showing up while they're ill, ensure there are policies in place to allow for sick individuals to stay home, and call health links for further information if to be tested. We continue to reduce personal non-essential travel. We know right now the curve is flat in Manitoba. We are still at risk for the importation of the virus, so we need to limit our travel outside of the province. Those returning internationally are mandated to self-isolate for 14 days under the Quarantine Act. Those returning from other provinces are required to self-isolate for 14 days as well. And again, those that are at increased risk of severe outcomes of COVID-19, those over age 65, those with underlying medical conditions, those with immune compromise, are advised to continue to practice our previous messaging, to stay home as much as possible, to go out only when necessary, to practice social distancing when you're out, including washing your hands very frequently. Businesses that have questions about how the orders apply to them can reach out to engagemb.ca, and we encourage Manitobans to continue to access credible information at manitoba.ca/COVID-19. So again, thanks to all of Manitobans for stepping up, and together we'll continue to battle this virus. So thank you very much. I'll pass it to Lynette.
Thank you. Good afternoon. I'm Lynette Siragusa, Chief Nursing Officer from Shared Health. I want to begin today by thanking the Long-Term and Continuing Care Association of Manitoba, which is organizing a donation drive to secure iPads and tablets for its residents. We know the strict visitor restrictions we placed in hospitals and care homes are necessary to protect patients and residents that are statistically at greater risk of serious illness or even death of COVID-19. However, we also appreciate that this comes at a cost of separating these people from visiting in person with their loved ones. We have seen families of care home residents do their best to bridge that gap, including window visits and telephone calls. And now the Long-Term and Continuing Care Association of Manitoba is borrowing an idea from the hospitals and health centers where tablets and iPads have been donated to help patients connect with loved ones through video chats. These donations have worked in hospitals to boost patients' spirits and reduce their feelings of isolation. So if you or your company can help by donating new or refurbished tablets to this worthy cause, please do. You can find more information online at roadtocare.ca. I wanted to give a report on our new patient portal to access lab results. So that portal went live yesterday, and it was a successful launch. As of 3 p.m. yesterday, we had 473 people who had registered for the service on the Shared Health website. And of those, 275 people had already received their results online. Additionally, our COVID-19 contact center had received 132 calls from people who were seeking their test results as of 4:30 p.m. yesterday. So this patient portal and this phone number will give Manitobans faster access to their negative lab results. And we hope that that will reduce the stress and anxiety that may come with having the test done. So as a reminder, public health officials will be contacting those positive COVID testing results, the patients, as soon as they receive them, and provide some instructions and reassurance to those individuals. I also wanted to give an update on our alternative isolation centers, which launched on April 7th. So as a reminder, this is a program that we set up to support those who are unable to self-isolate at home, whether that be for vulnerable populations who are experiencing homelessness and need a safe place to self-isolate, or healthcare workers or contacts of people who are positive who can't self-isolate at home or perhaps have a high-risk family member in the house. So for the week of April 22nd to 28th, we can report that 11 people have stayed in the hotel as part of the program. Some of those are international travelers who've come home. The average length of stay for those individuals was 14 days. And since its launch, 37 people have received referrals either from staff health or from public health, and 13 individuals have accepted the offer to isolate in a hotel. Our shelter program is another option that is available. Last week, they received 17 new referrals, and currently there are 9 people in isolation. And the feedback from both these centers have been very positive from the participants. We've heard that it really reduces the level of stress, and they're appreciative of the ongoing public health check-ins that they receive while they are staying away from their families. So with that, we will... Oh no, one more thing. In answer to the question yesterday about the Spartan cubes, I just wanted to follow up that a down payment was made originally. We won't be receiving the Spartan cubes as of this time. However, no decisions have been made as we're waiting for more quality tests to be completed, and then we will make a decision after that. Okay, now we'll open the line to questions.
Thank you. A reminder to our reporters online, you will have one preliminary question and one follow-up question. Up first this afternoon, from CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwin from CTV Winnipeg. I'm wondering a little bit about the new death. Was that person in hospital, or had they already been discharged and then some complications happened? Do you know anything further?
Well, we respect a lot of the privacy of the individual. So this person was in hospital. They were previously in ICU, and unfortunately passed yesterday. So our thoughts go out to their friends and family.
So I'm wondering about, are there any age limits on the testing now? Like kids at all, or like younger kids?
Nope, there's no age limit. Any symptomatic Manitoban is eligible for testing.
From City News, Jonas.
Good morning, folks. Good afternoon, I suppose. It's Jonas Gilbart, City News. Dr. Roussin, regarding this potential outbreak you touched on, can you elaborate as to, you say there's 5 cases, I guess, are these rolling in one a day, or how is this exactly playing out?
Yeah, so we know right now there's been a total of the 5 probable cases on here, and this has been over the last few days that cases have been detected, and certainly it's led to a very thorough contact investigation and a number of people being advised to self-isolate and in very close watch for symptoms. And so that's the information I have on that cluster.
And I know privacy is a serious concern, but you mentioned earlier this is not healthcare related. Is it food related? Is this a facility that had a lot of contact with folks that may have been coming in and out of?
So this is not a healthcare related facility, and then at this point there's no concern from public health that it poses a risk to the public. So the investigation has been dealt with at the site itself.
From the Winnipeg Free Press, Danielle.
Good afternoon, Dr. Roussin. This is Danielle from the Free Press. Can you clarify on the nature of the establishment, where the cluster was in the Prairie Mountain Health region? Is it a food processing plant?
Yeah, so we're because of privacy issues, we're saying it's not a healthcare related facility, but because it doesn't, the investigation shows it's not putting members of the public at risk. It's been investigated internally at the site, and so we're not giving further details about that.
Thank you. Can you tell us if the individual who passed away yesterday in the Southern Health region, was that person in long-term care?
No, this is not a long-term care facility.
From Global, Marnie.
Good afternoon, Marnie Blanche from Global News. Dr. Roussin, my question is related to enforcement. If someone sees a business that is either not operating or abiding by the new reopening rules, or if a business owner is having issues with clients or customers not abiding to their rules and they're not able to enforce that with them, who do they call or what do they do? Is there a number they can call? I know public health officers and different liquor and gaming authority officers are enforcing this, but who can they call, and is there a number, and if so, what is that number?
Right. So there's the health protection site, and it'll be it's up on our website, so we can post it there. But it's the health protection unit, and that's for concerns related to businesses. So that's who can be called for that, and they do a lot of outreach, they do a lot of inspection, but they can also respond to significant complaints as well.
And as a follow-up question, some businesses feel that the reopening plan is too much too soon. Either they aren't reopening just yet because of it, or they have concerns that they'll be fined because they can't abide by the new rules, or can't get access to hand sanitizer, or a number of things. How do you respond to those concerns?
Yeah, I think the concerns are real. We acknowledge that. It was a balance. It was a balance of keeping the restrictions in place longer than they needed to be, or giving places the opportunity to open if they were ready. So it's a balance. So these were not directives. Nobody's directed to open. This is just a lifting of restrictions that we could do as soon as we felt was safe. And so if we delayed the opening by a week or 2 weeks after we thought it was safe, certainly we'd have to answer questions on why are we leaving restrictions in place longer than we needed to. So it is a balance. I certainly hear them, but the balance was in favor to lifting the restrictions as soon as we felt was safe, and that's where we went, knowing that certain businesses may be ready, others, and a lot of respect to them if they feel they need to delay for a bit to get ready for this. So it's challenging times, but our decision was that we wanted to impose the public health restrictions for the least amount of time that was required.
From the Brandon Sun, Bud.
Yes, Bob Roberts from the Brandon Sun. Dr. Roussin, could you clarify for me on the 5 in the cluster? I don't quite understand if we've had no new cases in the last couple of days. I'm not too sure how many, only 1 today. How is it we now have suddenly 5? How does that work?
Yeah, some of them are these new cases. We had a couple over the weekend and on Friday. So it's been over the last number of days that we've seen these cases develop.
These are positive, probable positive?
These would be, I believe the 5 have been confirmed. I'm not sure they're test positive for the 5.
I'm going to cheat a bit and go with my follow-up question here. Regarding the 30-day restriction on prescription drug refills, do you have an idea when that will be lifted so people can order more than 30 at a time?
I don't have a specific date or a specific action that's being taken place. What I can say is that's something that's actively being reviewed right now to be able to address it in a safe way that still balances the needs to ensure a safe medication supply.
From CJOB, Alicia.
Hi there, Alicia Dacey from CJOB. Mr. Rusa, our Chief Public Health Officer, Teresa Tam, says that screening using temperature screening is not particularly useful and it hasn't been as successful as they hoped. Are we still doing that here for healthcare personnel who are coming into hospitals?
We are doing it at some sites, but not all sites. I think we've stopped doing them where it was oral temperatures, where you had to be in close proximity with the person that you're screening. We are still using it in some sites where they can do it from a distance, but that's not the only criteria we use in the screening process. So we do ask all the questions about have you traveled, do you feel sick, do you feel like you have a fever, are you coughing, sniffles. So we don't look at one criteria, we look at a selection of them, and we also trust our healthcare workers to self-declare if they're feeling sick and they shouldn't be at work. That has to be allowed and happen as well.
Thank you. For my follow-up, Dr. Roussin, given that tattoo parlors are already under very strict sanitary guidelines, we've had several reach out to us and say it's not fair that they're not allowed to open, and now hundreds of people have signed a petition to see tattoo parlors open. Can you explain the reasoning for tattoo parlors to stay closed when massages and hair salons are allowed to open?
Yeah, so there's a number of things, and certainly when you do a phased approach, a gradual reopening, there's going to be businesses that aren't on that first list. And so the answer to many of these questions is the same, as we just can't open up everything at the same time. We have to have a phased approach to this. It's too risky to open up everything at the same time. So there's going to be businesses that aren't able to open. And so we get a lot of questions, and we certainly hear them and certainly understand that these restrictions have imposed a lot on Manitobans. At the same time, we get questions on that the opening is too quick, but then also the questions that we didn't include enough in the opening. So it's a balance, and certainly we hear everyone's point of view on it, but we have to make decisions. We just know that we can't open everything. We think Manitoba's plan's a very robust plan. We have a number of services that are able to open right now, but we just certainly can't open up everything at once. And so certainly our decision making on that was to not include those facilities at this point. We're certainly going to review things moving forward, but they're one of the groups that are not included in phase one.
From the Winnipeg Sun, Scott.
It's Scott Billick here from Winnipeg Sun. First off, thanks, Leonard, for the update on the sporting teams. I guess my first question is to Dr. Roussin. Just asking or curious to know, when somebody goes into ICU and then comes out and then dies, is there a reason why they weren't maybe placed back into ICU? I know you can't get into specifics and privacy and stuff like that, but just trying to understand how a person would die in hospital, just in a regular setting instead of in ICU if the situation had such a serious outcome.
Yeah, there's so much individual variability with a question like that, so I can't really give you anything that wouldn't get into specifics of this person's personal health information. So I hear you. I think it's a reasonable question, but to really answer that would be delving into personal health information.
Fair enough. And second question, I guess for you as well. The low testing numbers yesterday, I suppose. I mean, there's been some higher ones, but we're not even close to 1,000 at this point, and maybe a little closer on a couple of days. But what does that say right now about the situation in the province, given maybe some of the low testing, even though that it is open to any symptomatic Manitoban at this point?
Yeah, I think it's hard to know exactly what that means. I think the much better indicator of where the virus is in Manitoba is our positive test rate, which is about 0.3% right now over the last 7 days. So we have a very broad testing criteria. Any symptomatic Manitoban can present. We have a number of test sites. So for the most part, it's demand right now. And so we're still encouraging Manitobans to be tested, but the low test rates, I don't think we can conclude anything from that. But we can see that we have the capacity to do multiple, many more tests than we're receiving right now. So that's really important that we have that capacity should the demand increase. And then we have a really low test positivity rate, which tells us that there's not a lot of transmission of this virus going on. We certainly see the virus here, so we have to still be cautious because that trend could sure turn around if we're not.
From CBC Radio Canada, Mohammed.
Hello, Dr. Wilson. It's Mohammed from CBC Radio Canada. I have a question about the small cluster that you mentioned. Do you know how these cases have been infected? Is it travel-related or contact with a known case or community transmission?
Right. Yeah. So good question. So for the index case of that, I don't know offhand on where it was acquired, and then certainly the rest of them were contacts of that case, and that's why we're declaring it a cluster. So I don't have information on on how the index case acquired it.
Thank you. And as a follow-up, just a different question. Health authorities in different countries, in Quebec, for example, warned this week of an unusual and potentially serious inflammatory condition for children, possibly linked to COVID-19 and called the Kawasaki disease. Have you heard about that, and did you notice something like that in Manitoba?
Yeah, I'm sorry, I didn't catch that totally there. Can you repeat that?
Yeah, sure. Sorry about that. There are some health authorities in the world, and in Quebec, for example, warned about an unusual and potentially serious inflammatory condition for children, which could possibly linked to COVID-19, and it's called the Kawasaki disease. And have you heard about that? And did you notice something like that in Manitoba for children in Manitoba?
Right. Yeah. So certainly Kawasaki's disease happens in Manitoba. It's often an unknown cause of it. I'm not aware of any cases of Kawasaki's that have been related to COVID in Manitoba. Certainly, we know children are underrepresented in the numbers. Far fewer cases are detected in young children. But no, I'm not aware of a Kawasaki's case that's linked to a COVID positive child in Manitoba at this point.
From CBC Manitoba, Aiden.
Hi, yes, Aiden from CBC News. My question is for Dr. Roussin. What must employers do to keep their employees safe in spaces where physical distancing is difficult? So, examples I'm thinking of would be line cooks in a kitchen or cooks in a food truck. What must employees do to keep those employees safe?
Right. Yeah. So good question, and this is going to be vital as we start to reopen the economy and as we start to try to loosen things even more as time goes on. And so again, it gets back to the basics of this virus, right? So this virus is almost is predominantly spread by close, prolonged contact with people showing symptoms of infection. So cough, fever, runny nose, sore throat. So one of the most important things is that ill people don't show up for work. Ill people don't go shopping or go out for food. If ill people stay home, we're going to have a dramatic reduction in the risk of transmission of this virus. Frequent hand washing and doing whatever you can to limit prolonged close contact with others. Certainly in certain places, they have the option of wearing non-medical masks as well. Again, that doesn't protect the person wearing it. It protects the person around them. But what's really vital are those basics. Washing your hands frequently, staying home when you're ill.
Thank you. And my follow-up is also for you, Dr. Roussin. What is the wisdom of allowing cosmetic surgery clinics to conduct non-urgent procedures which could be using up PPE right now?
Yeah, and so if you look at our health orders or the public health orders, we had never restricted the practice of regulated health professions, such as the regulated health professions of physicians, nurses, or nurse practitioners. And so the decision to do that is one on being prudent. On the necessity of those procedures, as well as things like PPE that you say. And again, this is, our orders aren't directing anyone to do any procedures. So these are up to the professional regulatory body for it. So we just didn't limit the practices of physicians, nurses, or nurse practitioners.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, we've seen some concerns further west about COVID-19 outbreaks in meat processing plants. So I'm wondering if I could ask you, I know you don't want to name the workplace where this cluster has appeared, but is it in a food processing facility?
So, well, I mean, we're not going to disclose any more about it. I think that if we were in depending on the situation like that probably would be something we would disclose, given the issues in other places. So, at this point, we're not disclosing what it is. It's not a healthcare related facility, and our contact investigation shows it's not at risk not posing a risk to the public in general. So, we're not going to declare the specifics of it.
Okay. And I apologize if I missed this earlier, but the gentleman who died most recently, the man in the 70s from the Southern Health Region, did he have underlying conditions?
There was underlying medical conditions, yes.
Thank you. We have a few minutes left, so if our reporters online have any further questions, please proceed.
Hi, Aidan from the Free Press. I just have a really quick question about the public health investigation into the Prairie Mountain cluster. Is that concluded if you don't yet know where the index case was acquired?
So I don't have information on that. There sure may be information on how the index case had acquired it. We are just announcing today that we had this cluster, that the investigation is underway, and that investigation doesn't pose that there's posing a risk to the public right now. So that's why we're not disclosing much more information on it.
Dr. Roussin, it's Jonas from City News. Just a question for families that are watching this progress. If, let's say, you have been isolating for 14 days, your kids have been isolating for 14 days, grandparents have been self-isolating for 14 days, when do you think it would be safe for families to get together in small groups, like slowly expanding that bubble?
Yeah, and so again, we want Manitobans to make a informed choice. So in a situation like that, where no one's been real in contact with anything, no one's ill, then you can use your judgment and meet up. We would still advise, if you can do so outside, if you can minimize any close prolonged contact, then even better. For those that are involved in those groups that are, over 65 or any underlying medical conditions, then extra caution is required. So, our public health orders certainly have never limited those type of gatherings, but public health advice is we want Manitobans to be aware that prolonged close contact is one of the risk factors for spreading the virus, and so certainly if you're symptomatic, this must be avoided. And if you're advised to self-isolate for any reason, then you need to do so. And then making informed decisions about these type of gatherings. We know it's been tough. We want Manitobans to make those informed choices. The risk in the situation you outlined there is relatively low, but no one can say it's zero. So people have to make those informed choices.
Hi, Aidan from CBC News. My question is for you, Dr. Roussin. Regarding drive-in theaters, we've heard from some owners of two in the province who are wondering why they were not included in phase one, because they feel that they should match up with other locations such as campgrounds or places that serve food or have shared bathrooms.
Yeah, and so I mean the answer that I would give to almost any business asking this question is we just can't open everything at once. And so that's going to be the answer, is that we have to draw a line somewhere. We have to have a phased approach to things, and certainly that's going to leave some places that we're wanting to open up. I mean, we even hear of places that don't want to open up that are included. So it's a balance, and these are tough considerations. We wanted to leave the restrictions in place for the shortest period possible. And so that's why we lifted them at this point. I can say with the drive-in movie theaters, this is something we are looking at right now, and we'll probably have some more information on that in the near future, because we are, as more information comes in and more details come, then we're able to change our orders over time to suit what we think is best for Manitobans.
Aidan from CBAC again. Sorry, that's just one additional question for you, Dr. Roussin. And I apologize if this was already answered earlier, but the gentleman who passed away, was he receiving any form of specialized care, not ICU, but just generally any form of specialized care? And if so, are you able to share with us what that was?
Yeah, it's a good question. I don't know that. It would probably be pretty personal health information, but I really don't know those type of details on the case. We were notified of it this morning, and certainly it's sad to see each of these cases, and we get lost in the numbers. But we certainly realize these are all Manitobans that we lost. So, but I don't have that information for you.
Thank you. Dr. Roussin, Danielle from the Winnipeg Free Press again. Can you please clarify which Indigenous partner agencies would be consulted prior to the release of data related to the number of Indigenous people who have been tested for COVID-19?
Yeah, so this goes back to work with the Assembly Manitoba Chiefs, and a data sharing agreement that was made between the province and those organizations, and it really respects the a lot of the principles, ownership, control, access, and possession of First Nations and Indigenous data, and so at this point we don't have any cases on First Nation communities. And so right now there's thought, from First Nation leadership that there isn't the time to really disclose any information that we have right now.
Well, thank you, everyone. And this concludes today's media briefing.
Thank you.
Thanks.